Hello everyone, myself Preeti Sharma, Assistant Professor in AKtU Ghaziabad. So, in the today's session, I will discuss about the general principle and the prevention and its control of drug addiction. So, as all knows that what is drug addiction? Drug addiction is basically a chronic brain disease. It characteristics by compulsive at times uncontrollable drug craving, seeking and use that persistent even in the face of extremely negative consequences. Drug addiction is basically a substance or means using a substance that affect a person brain and behavior and leads to the inability to control the use of the legal or the illegal drugs. Means if a person is using a substance that affect a person brain and behavior leads to the inability to control the disease, and means we have to control inability to control that drugs which is illegal and illegal drugs, that and the person may suffer from the personal brain disease, the person's brain disease. Drug addiction is a chronic brain disease, you can see here, and it is characteristics by compulsive at times uncontrollable drug craving, seeking and use that persistent even in the face of extremely negative consequences. This is a, you can see here, it is a chronic disease, loss of control and the compulsive use and the use of negative consequences, means inability of a person to stop that drug. It may be either legal or illegal, and it will produce the loss of control of a patient, and it ultimately suffer from the chronic brain disease. It's a drug addiction. Now, you can see here the cycle of addiction, how the drug addiction means what the drugs do to the patient, means it require an urgent need, means the person can't live without the drug. This is a whole cycle, how the improper behavior, confusion, frustration, pain, fear, anxiety, feeling of means very powerlessness, physical release and the relief. The person is suffering from the this type of symptoms if the drug is avoided, means the drug is not given, that is legal and illegal drugs, the person may be addicted with that drug. First one is old behavior pattern. Second, you see unsatisfying outcomes. Third is confusion and frustration, means if the person is addicted, then there will be a confusion and the frustration. Fear and the anxiety, pain, fear and anxiety, building the anger and the frustration. The person will build the anger and the frustration, feeling of powerlessness. Now, the next is explosion of anger. It is physical release and relief. Now, next is someone is hurt by what happened, guilt and shame, and urgent need. They required an urgent need of these drugs. First one, old behavior pattern. Second is unsatisfying outcomes, means they are not satisfied with their with the outcomes, what are the results of particular, if anybody is not means we can say the urgent need of a person will produce all this type of symptoms. There is confusion and frustration, pain, fear and anxiety, building anger and frustration. Next is feeling of powerlessness, expulsion of anger, physical release and the relief, and the physical someone if one hurt what happened, and the guilt and the shame will feel. Now, drug addiction is not able to control the means we cannot control the symptoms that want to be alone, change in dress and the appearance. Means some of the symptoms you can see in the patients that he want to be alone always, and change in dress and appearance, change in interest and activities, lose their whether it will lose or gain the weight, physically hurting the people, absent minded, it is totally the absent minded, want to be alone, and change in dress and the appearance, change in the interest and the activities, loss or gaining the weight, physically hurting the people. These are some symptoms. So, can I come next is illegal and legal categories of drug. Illegal drugs cannot legally means first of all I will give here the differentiation between the or the what are the difference between the legal and the illegal drug. Legal drug are those drugs which can be brought to the counter, means over the counter, or prescribed from the medical doctor, that comes under the legal drugs, that is caffeine, nicotine. These are some examples I given here. Means they may be bought or they may be present over the counter. OTC, these comes under the OTC medications, it is a legal, and illegal means cannot be legal and cannot be legally manufactured or bought or sold by the United States. They are not manufactured legally, or it may be sold, bought or sold illegally, cannot be manufactured. Manufacturing is not legal, it is also illegal. That type of drugs is cocaine, heroin, marijuana and hallucinogen, cocaine, heroin, these are some examples of illegal drug. Now, the legal is caffeine, nicotine, alcohol and well. These are some of the example of legal drug. Legal drug, this means present over OTC, present over the counter, but they are not present over the counter, they are manufactured, not OTC. Manufactured under the illegally they are manufactured. Now, some classification of drugs means this some of the we can say here this some of the stimulants, depressant, we can classify the drug addicted means we can classify the drugs which comes under the this one is inhalants like nitrous oxide, laughing gas, amyl nitrate and chlorohydrocarbon, kerosene spray, and some of the stimulants like cocaine, crack cocaine, amphetamine and methamphetamines. These are the example of stimulants. You can see here the examples of the cocaine, crack cocaine, amphetamine and methamphetamine. These are the examples of the stimulants. Intoxication effects produce increased heart rate, breathing rate, energy, alertness, elevated blood pressure, loss of appetite and increased mental activity, euphoria, hyperactivity, restlessness and the anxiety. These are the examples of the stimulants. Now, I told you in the inhalants, next you come to the inhalants, that is first example is amyl nitrate, means we are using the inhalers like amyl nitrate, and the next one is chlorohydrocarbon. Chlorohydrocarbon is CFC, is chlorofluorocarbon, and that comes under the chlorohydrocarbons like kerosene, kerosene spray, kerosene spray, kerosene spray. Now, you can have like various weed and the grass, that also comes under this marijuana category, and opium. Next is narcotics and some of the depressants. Depressions means used illegal to produce intoxications to counter the effect of the other drugs, and this depressants is for example barbiturates and the tranquilizers, barbiturates, barbiturates means, and this is illegal to produce the intoxication to counter the effect of the other drug, and blue drills also comes under this. Blue drills and tranquilizers, equanil, hallucinogen, and the various narcotics like heroin, smoke, brown sugar. This also comes under the category of the illegal drugs, and the causes of the drug addiction. First one is curiosity, second is gateway, third is drugs, and the fourth is peer pressure and the environment. These are the some of the causes of the drug addiction. And now the next is how the drug addiction began, how it began or how it started. Means first is curiosity or the friend pressure, means some of the people under the, when the person will come under the pressure of the friends, then he able to take that means repeatedly using in the repetition the person is using that type of drug, illegal drugs under the friend pressure. Frustration and depression, social pressure, desire for excitement, feeling of independency, desire for the more work, looking for the different world and looking for a different world, relief from the pain, family history, excitement and the adventure. Means these are some of the points you have to remember why the drug addiction began. First, I told you that drug addiction begins due to the curiosity. Means if the person is very curious to use that type of drug, it begins or it become habitual to that type of drugs. And friends pressure, frustration and the depression, social pressure, Again, the desire for the excitement, feeling of independency, and the desire for more work, looking for a different world, relief from the pain, and family history. Sometime it may be the some history of a family that it comes from family to family, means there will be a family history reason also behind that, how the drug addiction begins, and the excitement and the adventure. Now, you can see here the effect of illegal drugs. Drugs may you less aware and alert, making you feel carefree and can relieve, and they can make you sleep, have confusion and frustration, and even sleep into a coma. For example, heroin causes psychological and physical dependency, which can lead into coma and even worsen to death, as you can choke on your own vomit. Means effect of the illegal drugs, you can see the side effect of the illegal drug. If a person is using the illegal drug, I told you that it is not legally, we can say uh, legally is not manufactured or sold, so that comes under the illegal. Drug may be aware and alert, making you can feel carefree and can relieve the pain, and they can make you sleep and have convulsion and even sleep into a coma. For example, heroin causes psychological and physical dependency, which can lead into coma, and even it may worsen the death by causing or by vomiting. These are some behavior warnings. First one is poor work, decline in performance, financial problems. Some of the changes in the behavior, sudden change in the friends and associate, accident or trouble prone, and you can see here the lack of motivation and withdrawn from the society, unexplained anxiety. Now, these are some physical warnings: bloodshot eyes, change in appetite or the sleep pattern, and the sudden weight loss or weight gain, deterioration of physical appearance, unusual smell on birth, and impaired the coordination, loss of coordination and poor judgment, slow the reflexes and distort the vision, means the vision is totally distorted or distract, you can say here. And another one is memory lost, means the person is not able to remember the past, what he did in the past, so means memory loss. Now, these are the conception of the various drugs like pain relief, inhalants, tranquilizers, hallucinogen, stimulants, sedative, cocaine, heroin. These are the conception, these are the drug due to which the person is not able to avoid it, means they will produce the addiction in the patient. These you can see here the consumption rate of the various drugs. For example, pain relievers, inhalants, tranquilizer, hallucination, you can see here in this graph. Now, this is a graph, means you can see here the National Household Survey on Drug Abuse in 1999, and you can see here this survey. In this survey, you can see here how many percentage of peoples are using in the past month these products. How to avoid the drug addiction? So, first of all, maximum penalty should be imposed on commuter in 100-meter from a school, use of minors or penalty incapacitation person or the runners, If the victim is very minor or mentally incapacitated, or we can say inability to have, or we can say inability means do not have a capacity, that is dangerous drug, mean penalty should be imposed on the person or drug addicted person. Dangerous drug is the proximal cause of death, and if a person, first is the penalty, a person is arrested who is found to be positive for use of any dangerous drug and shall be imposed a penalty of minimum 6 months rehabilitations in the government center for the first offence, means person should be minimum of 6 months imposed a penalty, should be arrested penalty and for 6 months. Again if a person found again second time, if he is found, she suffered the penalty of imprisonment of 1 day to 12 years, means of 1 year 1 day to 12 years the person may go to the imprisonment, and for it may means the penalty for the second time the person may have a 1 day to 12 years imprisonment penalty. So, this to avoid this, to avoid the drug addiction, learn to deal with life pressure, do not give up to the peer pressure and develop the close family ties, develop healthy habits. And how to treat the drug addiction: short term residential treatment, long term residential treatment, outpatient treatment program, individualized we can say the drug counseling. And these are some references which I have took from the various reference papers and the research papers. So, thank you for your patience. Hope all understood the drug addictions prevention and the control. Thank you.